nuts and seeds. But this diet is very hard to digest, especially if the child has some gut issues. It's high in fiber, it can cause bloating, and especially usually the children have much higher protein needs when they are sick than when they are healthy. So we have to focus a little bit, the diet is a little bit different for children which are sick. We have to realize that it is a crisis situation. It's not a normal situation when your child is sick. So that's how we have to treat the situation. And we recommend culturally appropriate. It's going to be different for different cultures. Usually it is food which is easily digest, bland, and it's probably not the most nutritious food sometimes. It's just high in calories. And some examples from different cultures will be chicken soup, plain rice, rice pudding, potato puree, or oatmeal. And this food is called comfort food. And usually comfort food is food which is prepared by the mother or grandmother, some food what the child is really familiar with, and is associated with home, with comfort, contentment. It's usually the food which is easily prepared. And some of the examples of comfort food will be macaroni, cheese, again, pudding, pizza, pasta, cookies, chocolate. So, it's not the most nutritious food, but it makes us feel good. And there is some science actually behind the comfort food, why we serving that when the child is sick. And that's because it's a food high in carbohydrates, which increase the availability of tryptophan, which is going to increase the level of serotonin in the brain, and that's resulting in better mood or kind of like relaxed mood. And also, if the food is good tasting, that means higher in fat, higher in carbohydrates, it's going to release the endogenous opioids and alter someone's mood. So the comfort food is familiar to the child and is associated with safety and emotional comfort. So that's the food which the child usually asking for when he's in the hospital, and we should be able to allow them to eat that food. I have a few slides about the importance of caregiver for a child, and the reason is we did some studies in St. Jude about how child eats when the mom is in the room and when the mom is not in the room, and especially the small children definitely eats better when the mom is in the room. So we think it's very important that the caregiver, and it can be mom, it can be dad, any kind of caregiver, grandma. So we think it's extremely important that the familiar caregiver is with the child, and it's important for the patient care. Mother or the caregiver is the best nurse, that knows the child the best, is concerned about the child's safety, welfare. She can prepare the food or choose the food that the child is familiar with, what's very important. And it's very important for the thriving of the children, especially of the small children. And it's also important for the mother or the caregiver to be with the child, because they need to they want to take care of the child, be close to the child, know about the treatment, understand the treatment, and be involved in the decision making. Also, it's important for the healthcare, because the caregiver can serve as a safety check, nurse or nurture the patient, provide comfort for the patient, and of course the child don't have to adjust to the caregiver because it's already familiar with the caregiver and the trust is already established. This is the target house what we are using for our families which are long-term in the treatment, especially transplantations, because we believe the sooner the child is out of the hospital, the better the child is doing, especially eating. So that's why we try to transition them to housing as soon as possible. This is one of the patient's room. So we have different priorities in And one of the most common questions I get is, why is my child not eating? And it's very frustrating. It's frustrating for the child, for the parent, and also for the dietitian and doctors. But we have to realize that the child wants to eat, but basically can't eat because of the side effects of the treatment, because of the disease, and other reasons. And some children actually think that the worst part of the treatment was that everybody tried to, make them eat, and they couldn't eat. So the diet can be also a source of extreme stress for the child. And we have to realize that and try to minimize the stress. There are different side effects of the treatment: dry mouth, nausea, vomiting, diarrhea, lack of appetite, taste changes, weight loss, constipation, and all this gonna contribute to your intake of the child. This is a graph from Dr. Rogers' article about different side effects, and you see that nausea, lack of appetite are the most common side effects during treatment. This is a transplant patient. So how can we help? So we can serve the comfort food, as I said. Just don't focus on food or appropriate nutrition at this time, but more about comforting the patient. Usually this food is high in carbohydrate and fat. It's easily digested. It's giving easily calories. It's not a good time to change eating habits. If the child don't have, the best diet before it gets sick, when the child is sick, it's not a good time to change the eating habits. We can focus on that, after treatment or later. Sometimes, or many times, it's easier to drink for the child than to eat. So many children during the treatment, they mostly drink their calories instead of eating their calories. And we have to serve food which is easily digested. So I'm going to give you some suggestions how to help the side effects, loss of taste. Some children, this is the most common side effects, and it's because of the different chemotherapy. It destroys the taste buds, so the child cannot taste the food. Then when the taste buds coming back, it's kind of weird. The taste can be really yucky or metallic taste. Usually the sour taste is the one which comes first, so they crave like pickles, which has no calories. So, but the loss of taste, it's really a problem, and it's scary for the patient as well, because they describe it as being blind, desperate, chaotic situation, source of great worry, feeling of powerlessness and frustration, and some describe it as getting divorced sunburn. And this is how one chef actually described that. You're going to grab some Haagen-Dazs vanilla, add hot milk, you think you know how it's going to taste, and it's tasty like nothing. All what you get is thick texture. So can you imagine that you have a 5-year-old and you're trying the child to eat something that has no taste, it's just, thick texture in your mouth. So it's really almost impossible to make them eat. So there are some suggestions, which I'm going to name just few, but for example, alteration in taste and smell. You can prepare food which is more colorful, so the color actually attracts the child will try something. Usually red meat has metallic aftertaste, so you can try to serve either chicken, poultry, or eggs. And definitely, because of the smell alteration, try to serve food which doesn't smell, and that will be cold food. Especially coffee make the children, really nauseated the smell. So you have to be careful about that. The sour food comes, the sour taste comes first, so you can try to serve something that is a little bit sour, and try to serve cold food because cold food doesn't smell. Another side effect is mucositis. Mucositis is extremely painful, even if it don't look in the mouth that that bad, even a small lesion is extremely painful. So if the child has mucositis, you can try uric food, bland food. You can use straw for drinking and use some pain medication before meal times. Dry mouth is another side effect. Again, uric food usually will help. Artificial saliva will help. Sips of water or ice chips will help. Popsicles are a good idea for dry mouth as well. We have some veg gum we are using for patients if they are old enough to chew, and it stimulates the saliva. Anything what is sour will also stimulate saliva. Some children have a lot of cramps and bloating and gas, and for that or heartburn, so usually we recommend to eat small portions during the day, not to drink with the food, because if you drink with the meal, it's going to make the content larger, so it's easier to be nauseated. Don't eat during treatment, really before treatment, better not to eat anything. And then a lot of children become lactose intolerant during the treatment, so it's many times it's a good idea to take the milk out of the diet, or maybe serve lactose-free milk or some milk substitute like soy milk or rice milk. Diarrhea is also common with some of the treatment, so we have to prevent dehydration. Usually the children are going to be on IV fluids anyway, but it's good to offer enough fluids, and especially some fluids with electrolytes, so with sodium and potassium. It can be any kind of sport drinks, and now we have the coconut water on the market, which the kids really like, and it's really full of electrolytes, so that's a good option as well. Constipation, many medications, I have here too, but many medications are going to cause also constipation. So during constipation, you offer a lot of fluids, drink something warm to stimulate the GI tract, high fiber diet, and of course use of softeners and laxatives, and that's usually a part of the treatment. Nausea and vomiting, we a little bit mentioned about it already, but avoid hot food. Hot food gonna increase the nausea. Greasy fried food is not a good idea. And then, kind of like during the pregnancy, just crackers, small portions during the day, something, some crackers before the child even gets up, and things like that. And of course, usually children are already on several medications for nausea. And loss of appetite, we use a lot of appetite stimulants in our hospital, and I'm going to mention that in my presentation. Also, use some supplements, I'm going to mention that, and just the peace during the meal time is very important too. Sometimes the child really gets stressed out about eating or not eating,